These are the faces of people who suffer from sleep-disordered breathing, a term which describes a range of breathing problems that occur during sleep. All types of people, men, women, young, old, lean, heavy, short, tall, in shape, out of shape, they can develop this condition. The most common type of sleep-disordered breathing is snoring, followed by a more serious condition called obstructive sleep apnea. Sometimes you don't know that you have a sleep-disordered breathing problem until someone else tells you. Snoring, which is produced by vibrations of the soft tissues in the throat, is a warning sign of a more serious condition called obstructive sleep apnea. Apnea, which literally means without breath, is a condition in which you may repeatedly stop breathing during your sleep. The most common signs of sleep apnea are loud snoring, choking or gasping during sleep, and excessive daytime sleepiness or fatigue. Other signs of sleep apnea include morning headaches, memory or learning problems, irritability, lack of concentration, mood swings or personality changes, depression or anxiety, a dry throat upon awakening, teeth grinding, acid reflux, frequent urination at night, and even sexual impotence. Typically, a family member or bed partner is the first person to notice the problem. Unfortunately, most patients or their bed partner only complain of the snoring and are minimally aware of other signs and symptoms. In some respects, the effects of untreated sleep apnea can be scary and can lead to hypertension or high blood pressure, stroke, heart attack, diabetes, and many other comorbidities. If you snore, or if someone has told you that you gasp or stop breathing when you're asleep, you should talk to your dentist or your primary care physician. So if you are concerned about your snoring or think you may have obstructive sleep apnea, talk to your dentist. He or she can perform a simple screening test to help you identify whether or not you have a problem. Depending on your risk, your dentist can work with your primary care physician to order a sleep study. Only after a sleep study can a doctor diagnose your problem, and depending on the results of your sleep test, you will be presented several treatment options. One of your treatment options will be a custom dental device that your dentist can make for you. If you have severe sleep apnea, your physician may start you out on continuous positive airway pressure, or CPAP, first. With CPAP, you can wear a mask in bed that is attached to an air hose and a machine at your bedside. The CPAP blows air through your nose, which acts like a splint to keep your airway open at night. CPAP is effective if you can wear it. However, more than 50% of people either refuse to or cannot tolerate CPAP. You may opt to have throat surgery to treat your sleep apnea, but this type of surgery is painful and has the lowest success rate. Today, there is a groundbreaking solution for anyone who snores or has sleep apnea. It's called the Tap. It's an easy-to-use custom oral device, much like a sports mouth guard. You wear the Tap while you're asleep. It works by holding your jaw forward, and it keeps your airway open. The simplicity and comfort of the Tap make it the most effective anti-snoring and sleep apnea device available today. The Tap consists of 2 small plastic trays that fit over your teeth. Each tray is custom-made so that it fits your teeth perfectly. Once you place the trays in your mouth, the upper and lower trays engage at the front to stabilize your jaw in a slightly forward position to keep your airway open at night. Your dentist will show you how to use a special key to adjust the position of your jaw. Your dentist will then give you instructions on how to make adjustments over a period of time until you reach your best possible treatment position. Most people, even those with severe sleep apnea, experience results the first night of wearing their Tap oral device. After a few weeks of wearing your Tap, your dentist will want to see you back in the office to evaluate how well it's working.
Within 2 months after getting his appliance, my symptoms all went away. And that's when I decided that this was the appliance of choice to be used to help people with sleep apnea. And I decided that I needed to help get the word out to other people how critical this problem is. And I realized that this appliance, I've used this appliance now on several patients with complete success. And I'm very excited about continuing using the appliance.
So if you are ready for a good night's sleep, ask your dentist about a Tap oral appliance today.